without further ado, let's get going and hear from our great panelists. So first, we're very privileged to hear from Hawa Mire, Executive Director at FAFIA, Canadian Feminist Alliance for International Action. As the Executive Director for FAFIA, Hawa is a senior leader, equity consultant, community organizer with 12 years of nonprofit experience focused on high impact community development. In 2017, Hawa completed a master's degree in environmental studies from York, where her research examined community storytelling as a place of transformation. Hawa is a critical writer, commentator, and columnist with Ricochet Media, and she's been featured in a wide variety of publications, including Maclean's and CBC, just to name a few. So without further ado, I will let us all hear from Hawa.
Hi, everybody. Good morning. Can you hear me okay? Volume's on? Perfect. My name is Hawa. It's such a pleasure to connect with you all. I'm the Executive Director for the Canadian Feminist Alliance for International Action. FAFIA, as it's known through its acronym, was founded after the 4th World Conference on Women in Beijing in 1995. And FAFIA is a coalition of over 60 women's organizations in Canada. We are a national feminist and women's rights organization that participates in the United Nations Treaty Body Reviews, Canada, and we report on the domestic implementation of Canada's human rights obligations as they relate to the protection and promotion of women's organizations. I want to be really clear because we're here on a panel around gender-based violence. FAFIA is not a service delivery organization. We're coalition-based and many of our members are service delivery oriented, but we are really advocacy focused. And we rely a great deal on the data and the information that's provided by incredible women and feminist organizations in Canada who are doing direct service delivery. So I'll launch right in and I'll encourage people to save their questions until the end. So the World Health Organization declared the COVID-19 outbreak a global pandemic on March 11th, 2020. That likely won't come as a surprise to any of you. We've been living through the ramifications of that. And since then, gender-based violence, including violence against women and girls and intimate partner violence, has escalated across the globe, but also here in Canada. We know it's not unique to Canada. We know this is something that is a cross-cutting issue, as Stephanie shared earlier as part of her opening. We know that COVID-19 may have exacerbated these inequities, but we've also seen the failure, it's demonstrated the failure of Canada's ability to implement human rights obligations. And this failure over time and its historical impact has had some material impacts on people's lives, particularly women's lives. CEDAW, along with other international instruments, has created an international legally binding framework on gender-based violence, including violence against women. In 1992, the CEDAW committee explicitly stated that gender-based violence is a form of discrimination. This legal framework was further recognized and clearly articulated by the UN Special Rapporteur on Violence Against Women in her report on the adequacy of the international legal framework of violence against women. She noted that an overall lack of holistic and comprehensive approaches to combating and preventing violence against women. That's pretty significant, I think, to have a rapporteur note that prior to the onset of COVID-19. So we know Canada is no exception, and the pandemic has only heightened the risk of violence. We know something has to be done. We also know that while COVID has increased the levels of gender-based violence and violence against women, we may not know its full extent, even as this pandemic is ongoing. It might take some time to really understand the significance. Hi.
Oh, are you back with us, Hawa? It looked like you dropped off there just for a second. I can see and hear you now, though, again, I think.
Yeah, I was moved. My position was moved to an attendee. Not sure what happened there.
Oh, no.
Yeah, that's okay. Okay, I'm back. Hi, everybody. Let's continue. So I'll start, I think, where I paused too. So early on in the pandemic, the press secretary for the Minister of Women and Gender Equality, which is the department that is often asked to resolve or deal with concerns that impact women directly, noted that an average of 1 woman in Canada is killed by an intimate partner every 6 days. And in both the January throne speech and the September throne speech provided by our Prime Minister, Our Prime Minister reiterated that the government has a commitment to dealing with the issue of violence against women and the importance of a feminist economic recovery for Canada. So experts and political leaders have clearly been aware of the potential and the reality for a rise in gender-based violence since the very beginning of the pandemic. And early consultations with frontline organizations told us we could expect a 20 to 30% rise in the rates of violence for certain areas in Canada. We already know that there have been reports of major spikes in calls on this front as well. We also know that gender-based violence continues to impact women, disproportionately impact women who face immeasurable barriers, who have added precarity because of their race, because of their socioeconomic status, because of their immigration status, and or health. And we know that Indigenous women in particular face even higher rates of violence. The causes of this increase in violence in relation to the pandemic have been attributed to a couple of things. One, the requirement for many people to isolate within their home or their places of residence, the lack of affordable housing for those who might be looking for alternative options or escape, and the closing or partial closing of social services, and the movement from these services from in-person services to largely virtual spaces. Self-isolation can really reduce the ability for women fleeing gender-based violence to socially interact and leave their home safely, while also increasing the stress levels that may be taking place at home. Research shows us that the stress of social and physical isolation measures, employment interruptions, or financial pressures can lead to increased conflict in the household. It may also lead to risk factors that are associated with a higher rate of intimate partner and sexual violence, such as alcohol use. And due to what is Canada's inaffordability around housing and an affordable housing crisis, women's shelters are often the only option for women looking to escape. But with resources quickly dwindling due to chronic underfunding and the added financial and operational pressure during COVID, shelters are often turning those looking for housing away. Maintaining staff at shelters has been difficult because of infections, the requirement around physical distancing, and a lack of testing resources and PPE for shelter staff. There was actually an excellent report just released this morning by Women's Shelters Canada about the impact of women entering into shelter spaces during COVID-19. The safety of women is further complicated when children are involved, because we know that children's health and safety can be used against those in really complicated and abusive relationships if they try and leave. Although there's been a mantra of we're all in this together, the burden of COVID-19 is not felt equally. It has been largely left to women to carry the brunt of our care economies, taking care of those sick, of children and family members who have lost their jobs, and women who have been largely regarded as disposable, even while facing tremendous health challenges. We also know here at FAFIA that we can move forward on human rights in Canada without acknowledging, committing, and creating a clear action plan to end systemic racism. In our current contemporary moment, we have seen just how quickly statements without any kind of action attached raise further questions and concerns for Canadians across the country in 2020. There has been a demonstrated increase of racism, sexism, and xenophobia, which we may see result in an increase in gender-based violence as well. We also know that the risks to the well-being of our healthcare workers during COVID-19, many of whom are women, are compounded by the effects of inequality and gendered violence. Black Canadians have been disproportionately impacted by COVID-19. In Toronto, the only city currently in Canada collecting race-based data around COVID-19, between May and July, Black patients amounted to 21% of COVID cases. These high rates of infection are directly related to existing inequalities and who is most exposed and who is most at risk during the pandemic. So those are just the people getting sick. What about the people taking care of those who are sick? 90% of long-term care home staff are women. 42% of those personal support workers are racialized. And if you dig deep enough, 18% of our personal support workers identify as Black, compared to just 4% of the population. This has to be considered in relationship to the increased levels of unreported violence and sexual harassment that women experience from colleagues, patients, and the general public, especially when they're on the front lines of a pandemic where stress levels for everybody are incredibly high. Women again face the brunt of violence directed towards them. During COVID-19, these essential workers who were heralded in the early days of the pandemic, called our heroes, have been placed at enormous risk. forced to work in precarious and unsafe conditions for low wages, and it's resulted in the death of many of our personal support care workers. Canada's government has not been generous to Black and racialized women working hard on the front lines. We also know that Canada's history of institutionalized mistreatment of Indigenous women and a lack of services that are run for and by Indigenous people are a barrier to Indigenous women who are seeking shelter or support. SAFIA continues to amplify the voices of Indigenous women's organizations who have been working for decades to draw attention and demand that all levels of government act on the increased levels of violence against Indigenous women and girls in Canada. 6 years ago, the Inter-American Commission on Human Rights found that Canada was not discharging its duties to prevent and remedy violence against Indigenous women and girls. 5.5 years ago, the UN Committee on the Elimination of Discrimination Against Women found that Canada is committing grave violations of human rights of Indigenous women and girls by failing to provide effective protection from discrimination, including by its very own institutions and agencies. 17 months ago, the National Inquiry on Missing and Murdered Indigenous Women and Girls reported that this human rights crisis is one part of the history of genocide of Indigenous people in Canada, and there's still no national action plan to respond to it. 17 months ago, that's over a year ago. This is a key issue which requires a structured, properly resourced, nationwide, intergovernmental response with an engagement process that's led by Indigenous women. Critical to this is addressing the social and economic inequities that Indigenous women and girls continue to face. So we know that violence against women and Indigenous women and girls was already at alarming levels before the pandemic, and COVID-19 has only served to make this worse. A survey conducted by the Native Women's Association of Canada reported a 7% increase of Indigenous women reporting intimate partner violence in the first 3 months of the pandemic, compared with rates over the previous 5 years. The federal government has to accelerate the development and implementation of a national action plan that responds to the national inquiry into missing and murdered Indigenous women and girls. COVID-19 is, far from a catalyst, but now makes it nearly impossible to ignore what is a considerable pressing issue. So I have a few calls to action that I think are important for the Canadian government to think about, but I also think is important for those of us in this room who might be Canadian to push our institutions and organizations to drive forward. One, we need a race-based and data-driven approach to preventing and addressing GBV. We don't know enough about who is experiencing gender-based violence and the uniqueness of their experience. We need to know more, and this has to be implemented now. Canada also has to continue to fund essential services and increase the funding of essential services that include GBV across the country. It must include GBV strategies in future forward moments. So in developing a crisis and emergency management plan, we cannot end up here again. The Canadian government also has to accelerate the development and implementation of a national action plan, as I stated before, that responds to the national inquiry into missing and murdered Indigenous women and girls. And finally, only 23% of global COVID-19 recovery and economic task forces are comprised of women. The task force for Canada's Action Plan on Women in the Economy has to have strong representation from women majority sectors and the feminist movement at large that reflect those most impacted by COVID-19. This is our ask of Canada, but this should also be the ask for organizations of their governments around the world. Women must be involved in any kind of action that we take forward. Thank you so much. It's been a pleasure speaking with all of you, and looking forward to more.
Thank you so much, Hawa, for your comments. Some, really disturbing data about the disparate impacts. And thank you so much for the call to action. I think the issue of representation and inclusion on, the COVID task force, of course, as we know, representation doesn't necessarily fix all challenges, but it's like that very critical first step. And, that's a dimension that I hadn't considered before. So thank you so much for sharing that. So we'll move forward to hear from our next panelist. Before we do so, I just wanted to give the response to our previous poll question. We have a bit of an issue with just showing the results again, a little Zoom technicality, but to let you know, for our first question around how many women experience gender-based violence globally, the answer was A, so that is 1 in 3. And Tatiana, if you'd like to project the second poll question now, and we'll just give people a minute to answer and we can see those results. So the question is, which of these is not a form of gender-based violence? Early marriage, female genital cutting, human trafficking, prenatal sex selection, or all our forms of gender-based violence. All right, so hopefully everyone had a chance to test their knowledge with the response there. Tatiana, I think you can close the poll and show the results. Yeah, we've got great response rate here. I think 86% of folks agreed that all of these are forms of gender-based violence. We will move on to our next panelist and hear more from her experience. So our next speaker will be Rawia Naum, who is the Gender Equality Specialist for the We Lead project. This is the Women's Economic Linkages and Employment Development Project, which is being operated by WUSC in Jordan. Rawia holds a master's degree in management and leadership from the University of Pécs in Hungary, and Rawia has more than 10 years of experience in a variety of different fields, such as gender equality, women's economic empowerment, project management, and business development. And look forward to hearing more from Rawia about her experiences working on GBV issues in her project. So Rawia, I can see you all right. I think if you can share your screen.
Thanks, Stephanie, for the introduction. I'm sharing my screen right now.
I see that you have started screen sharing, but it's not quite coming through yet, like it did earlier when we tested.
Yeah, now it works, I think, because the internet.
Okay, yeah, great. There we go. Thanks so much.
Thank you too. Today I'll speak about addressing gender-based violence and harmful practices during COVID-19 and MENA region, especially in Jordan. I'll go through about introduction of We Lead, then I'll go with some statistics during and before COVID-19 for the GBV. Then I'll go to some practices of programming here in Jordan and the intervention that We Lead project addressed during the pandemic. And finally, I will go for a statement for action, call for action. For the project, We Lead project as an introduction, it's Women's Economic Linkages and Employment Development Project, 4-year project funded by GAC. The aim of it is increasing women's empowerment for sustainable economic growth in Jordan. And to give you a look for the context, Jordanian context, the low rate of women economic participation was the reason behind this project, where the women represent around 56% of university graduates. However, only 14% of these women, they are really working in the labor force. And if we want to make a look for a global gender gap report, we will find also the participation of labor force women participation. It's around 138 out of 144. Our project actually contains of 2 components. The first one is to strengthen the capacity of TVET institution to deliver market-driven vocational training program in addition to reducing the gender-specific barriers, including the social norms that includes as well the GBV as an intervention. First, I want to give all of you some historical data regarding the GBV in the MENA region. If we want to see the percentage of married women, they reported violence regarding abuse cases, then we find that the percentage around 35%, and around 15% households across the MENA region includes a domestic violence. For more statistics, we will find familial violence is relatively very high in Yemen, Morocco, and Egypt, and the self-reported cases, it's low. In Libya, Jordan, it's around 7% to 6%. However, if we want to see the percentage of the domestic violence and the female victims, we will find them very high in Lebanon, Egypt, Morocco, and Algeria, which is the percentage between 66 to 82. However, by contrast, we will find Yemen and Libya with lower rates. That does not mean that female victims are lower in that areas. However, the reporting is for these incidents are lower. If we want to make a look for Jordan, just 19% of married women experiencing some form of domestic violence seek for help. And in Egypt, costs emerging from marital violence for survivor women and their families, it costs the country around 127 million euro annually. Now, what are the reasons behind individuals why they are not reporting the violence cases? First of all, the belief. There's the belief system that we have. There's in some countries, in MENA region countries, that they say women should tolerate violent treatment by their spouse to keep the family together. Another thing related also to beliefs is decision making. 70% in Arab countries say their husband have the final say in everything in the house. However, if this belief consists with the sexist mentalities or male domination, that will increase the percentage of the violence against women and will list the percentage of reporting these cases. Also, if women have have abuse, they refer first place for relatives, like female or male relatives, for support. Around 80% in MENA region turn to their family or female or male relatives for support. Lebanon stands out as exception, where nearly half of women victims say they report domestic violence to the local police. Also, we have a problem with reporting mechanism. It's either not clear or lack of efficiency to record and monitor the cases of GBV. Now, if we want to make a look for the negative consequences of COVID-19 outbreak, we will find the first thing that it's economic crisis that will lead eventually for risk of losing jobs. That also, plus for curfew and lockdown, will make isolation, loneliness, and uncertainties that cause also psychological health issues. All of that will make stress within families, loss of social interaction, and tension within the household that will lead eventually for domestic violence and GBV. Now, if you want to make a look to what extent has there been an increase in violence against women, especially domestic violence in context of COVID-19, we will take Jordan as a case study. For some Jordanian agencies, we found that 68% reported the decrease of gender-based violence. However, SIGI, a local NGO here in Jordan, Sisterhood Global Institute, they said this drop does not reflect reality. They actually received in normal days 650 cases per year. During the lockdown, they received 800 cases of violence against women. And if we want to make a look for Family Protection Department, they also reported around 33% during the lockdown. And in another rapid assessment that conducted by UNFPA, the respondent, they state like 68%, 69% actually, they stated that there is an increase in of the GBV cases since the beginning of the pandemic. Now, if we want to make a look if the protection orders available and accessible in the context of the COVID-19 pandemic, we will look for 3 countries, Jordan, Morocco, and Tunisia, and 3 countries, they have the similar thing. We can find that during the pandemic in Jordan, the protection orders were no longer accessible as the courts were closed. And Morocco, the state's response to fighting against the COVID-19 pandemic failed to take women's specific needs into account, either in terms of protection or violence, from violence or healthcare, sorry. And in Tunisia, the only option for women is just to file the report until the courts reopen again. Now, how other programming started to address gender-based violence during COVID-19? There's 5 ways, actually I mentioned them here. First one is digitalization, the services, such as social media, mobiles, website, and mobiles app. For example, UNHCR, they developed an application called Amani. And in this application, they receive referral and messages and calls using using even a voice recognition helpline calls. They could manage over 200,000 million monthly calls since March. And hotlines referral as well for family protection were available as well. The other method was cross-sectoral coordination and collaboration with other actors between government, local agencies, and also universities. And the continuous of this coordination and collaboration between the family protection and the civil society and humanitarian actors was a good response. And another term, there's a linking for all hotlines and emergency call numbers to single database so that all cases, even those from Ministry of Social Development, can be systematically referred to the police. Another third and fourth solutions they were provided is creating new entry points for accessing GBV help, like clinics, pharmacies, and shops. In addition to that, they need to expand the awareness about these new channels or these new methods. For example, UNFPA has integrated GBV supports in clinics where health providers can be the first entry point for women to seek help. And also they ensured to have clinical management of rape is available in the clinics, in the refugee camps and urban areas. In addition to piloting alternative solutions to have the support in pharmacies and food sellers. The fifth thing is the training of staff, services provided to deliver the new ways of delivery methods. For example, Jordan River Foundation has have conducted safe referral trainings for frontline workers of other sectors to promote safe referral. In addition, UNHCR, UNFPA, they conducted different training for case management organization and on case management and safety planning for GBV survivors during COVID-19. Also, rapid assessment were crucial to assess to which extent COVID-19 outbreak was there and to put another plan in case that the existing plan were not on their place. Now, we will speak about WeLead project, how we addressed GBV during COVID-19. I'd like to highlight that.
Just before you begin, I just wanted to flag 5-minute warning. Sorry.
Yeah, I know. Okay. Now, regarding WeLead project is, as we know, it's Women Economic Empowerment Program that have some intervention about GBV intersect to achieve the aim of the program. First of all, our program make a participation in regional networks such as prevention of sexual and abuse, and in order to mitigate the GBV across sectors throughout Jordan. In addition to that, we already developed our online training program for vocational trainings. We also moved to work online. Therefore, we developed online code of conduct and compliance system. in response to digitalization from COVID-19 that specifically seek to mitigate GBV or other types of bullying, harassment, online spaces during online outreach or training, and etc. And for the GBV awareness sessions during and campaigns, therefore, during the pandemic, we managed to make campaigns with our partner SIGI in order to increase the awareness about the GBV for the community, in addition to conducting sessions with our partners such as Juhud and NCFA, National Council of Family Affairs. And these subjects were for sexual harassment and financial abuse. And finally, we normally have intern and work environment checks. But even during the pandemic, we made sure to have at least phone calls or visits done, not only to check for the work condition, but also to make sure the interns know the complaint system and to ensure that they are not being abused within the context of their internship. At the end of my presentation, I'd like to say, my call of action is turning this crisis to opportunity. The COVID-19 crisis provides us to open our eyes to transform the domestic violence from the private family matter to a public concern, and also to put two solutions. One, in a short-term solution, where we need to establish a solid collaboration between the police and criminal justice system and health sector and local women's rights organization to provide adequate support for women survivors of violence. In the long term, the laws must be reformed and gender roles realigned toward equality, domestic violence. Otherwise, victims will remain discouraged from seeking help outside the family. I think I finished my talk. Thank you for listening. Thanks, Tiffany.
Thanks very much, Rawia. And I think it was really helpful to see we went from Hawa's amazing outlining of the issues at a high political level, the kind of structural and institutional challenges and context, and moving to a bit more of a meso level with your presentation and focusing on some of the actions that governments can take to address these issues, and introducing some interesting new strategies that you mentioned around apps, expanding the number of reporting and referral locations. So that was a really interesting and good focus on kind of the safeguarding systems that we all need to have in place. So thank you very much. And I think your call to action is very resonant. We've heard a lot of build back better and how can we see this as an opportunity for transformation. So I think your comments really tapped into that. So thank you very much, Rawia.
Thank you, too.
So I think we have one last question for the poll that Tatiana is going to help us with. Thanks, Tatiana, for posting that. So this question kind of looking at the influence of marriage on outcomes are related to gender-based violence. And I'll just give a minute to answer here. Okay, I think we can close the poll. Hopefully people had a chance to respond and see our result. Yeah, so 80% of people said that education was the factor that married girls had the lowest rate of. Phrase that a bit funnily, but thanks so much to those who participated. Yeah, indeed. So we see definitely that marriage at a young age makes it very hard for girls and young women to stay in education, to return to education. And as economic stress and pressure is put on families, there's also a pressure related to early marriage, especially in many cultures who have a dowry-based approach, and which is seen as kind of an economic opportunity for the family because of serious economic pressure. So that's also something to be mindful of in the context of COVID-19, the economic pressure that causes, and the challenges that we're also seeing in the education sector with school closures and delays. Now is our time for question and answers. We have just under 30 minutes to hear from our audience about what questions you have. Please feel free to use the Q&A chat box, which is at the bottom of your screen. In order to ask a question, you can direct your question to a specific panelist or have it as an open question. I think that as we're kind of waiting for people to generate ideas, I can maybe start with a question and then we can move forward from there, drawing on questions from the audience. So one question that I had for all of our panelists, so would love to hear from all of you on this, is that COVID-19, in addition to all of the gender-based violence issues and implications that have clearly been raised, it has also prompted a lot of discussions around reforming the aid architecture as well, in the sense that we need to rely more on local actors and less on international experts, quote unquote, flying in and out. And so my question is, do you think that a trend towards increased resourcing for national organizations or community-based organizations, would that significantly change the way in which gender-based violence programming is conducted or delivered? And what kind of changes would you anticipate? So perhaps I'll hand that question over to Hawa first, and we can go Hawa, Rabia, and then Qatar and Mohammed, hopefully if able to connect again.
Sure. So, I mean, I think this is a pretty broad question, so it's hard to narrow into. I'm sure there are different contexts for different countries and how they operate and the value of local actors versus kind of regional so local actors as being either grassroots or regionally affiliated or nationally affiliated or community-based. So I think there's a lot of ways that we could interpret what we mean by local actors. And I'd say that Canada and, Korea in Canada has done a lot of incredible work in doing some research around this piece. But in general, Canada hasn't particularly had a good history of funding national women's and feminist organizations, who are largely kind of the advocacy body that talks about gender-based violence. We tend to conflate service delivery with policy, meaning we fund frontline work, but not folks who are pushing for institutional or systemic change. And the assumption is that folks who are doing service delivery or organizations that are doing service delivery at that very granular level will also be able to pull out and then do advocacy-based work, even though they're only funded to do the service delivery. So there's that's been a bit of a disturbing trend over the last couple of years. And we know here in Canada that, the former Conservative government, Harper's government, completely gutted women's organizations, and it's taken years for them to rebuild to the advocacy levels that they were at. Many organizations still not going back to where they were. So I say all of that to say, for sure, I would always recommend that national and regional organizations are funded. I would also recommend that policy and advocacy-based organizations are funded in tandem with service delivery organizations, so that we're also pushing forward some of the systemic change that needs to happen, and doing some of the coalition building so that we can get to that change. I'm a community organizer in my heart, and so I'm always the person that's going to say grassroots efforts have a substantially different impact than top-down approach. The across the board, period. We know that, we've seen that. And so wherever money can be pulled in to support people doing work at a direct frontline level, I think is always a bonus and a benefit to the communities, especially women benefit tremendously from that kind of an approach.
Great, thanks, Hawa. And I liked your comment about a tendency to view funding service delivery as the same as implementing a policy, which I think is a very resonated a lot. Yeah. Rabia, did you have a remark you wanted to make on this?
Yeah, I do agree with Hawa. And actually, I think local actors will have more power on the government than international experts and studies. Using some local movements, we can really develop with the government strong policies and the program approaches to prevent and mitigate respond for sexual abuse or gender-based violence. And in addition, we can develop the existing policies and the programs within the localization of, because of the localization of the context when we are speaking about local actors. And I would like to highlight, like, there is a lot of local initiatives that started by individuals then they continue to finish some gender and some gender-based violence laws or practices in this regard. And I think they succeed in doing that to some extent. So local actors, from my point of view, they are very important to work more than just international experts and studies.
Just echoing again what Hawa and Rabia had mentioned, really, I would say enhancing grassroots participation in programming is really the route towards sustainable change and lasting impact in community engagement, and really adopting that intersectional solidarity and distinctive really approach to engagement, in which empowering the folks that are at the ground and who are the experts of their own realities and needs, and adapting programs at that level as opposed to a top-down approach, which may not necessarily be reflective of the realities of the folks that we engage in the field. And that as well goes to the question of how to respond to gender-based violence, is by really engaging the community at the grassroots level and understanding what would be the sort of the entry points that would be effective in tapping into and really contributing to impactful prevention programming without causing harm. I think that would be like the approach that I would add as well to the discussion.
Great, thanks so much. And I see that unfortunately Mohammed has commented that he is still having a lot of network challenges. So Mohammed, if your network feels stronger at some point, feel free to jump in. But I am seeing now that we have some questions in from the audience. Earlier in the session, Charity asked a question, and I did see that Rabia provided an answer, but that was a private answer. So I just want to make sure that there's an opportunity to answer Charity's question from others as well. So Charity said in another meeting on a similar topic, the key question was how best can we influence systems to prevent GBV, but also how best can CSOs address the root causes of GBV and ensure girls and women are safe. So there, I guess, touching on this issue of balance in programming between systems change, addressing root causes and prevention. So Rabia, you provided an answer to that question for Charity. Did you want to elaborate on that so that everyone can see your answer?
Yeah, sure. Actually, what I wanted to say for the solutions, actually, from my point of view, raising awareness and education, they are really big part of solving the problem of the GBV and ending the GBV. I think education about GBV must started in very early stages for the kids. And for the second part of the question regarding the CSOs, I think they must have more efforts to do more studies, research, and these research to be again more localized and based on the local context. Therefore, as I mentioned earlier, the local actors really have good power on the governments, and I think we can work from a local context in order to change the policies and the approach in order to prevent and mitigate and respond to any sexual abuse or GBV as well.
Great, thanks, Rawia. I'll just open it up if Hawa or Qatar have anything they want to add on that kind of question of balancing systems change, addressing root causes.
So I don't have much to add. I think Rawia has captured a good piece of it. Of course, I think Safia's role is more in the policy systems change piece, and so that's I think why my kind of remarks always include if you're going to fund service delivery, you also have to fund some kind of advocacy policy change work. Otherwise, kind of service delivery becomes its own. It just spins. There's no people are doing the work to address the needs on the ground with no real substantive shifts that make it possible for kind of a transformative world for all of us.
Yeah, the importance of having an enabling environment to do your work in, definitely. Great, getting a lot of other questions in as well. We have one question that is a clarification question for Mohammed on statistics. Clarifying the statistic that you presented, Mohammed and Qatar, on the percentage of girls and women in your context that have experienced genital mutilation. Perhaps, Qatar, this is something you could clarify based on what you see in your slides?
Sure. Which slide would you like clarification on? Sorry, Stephanie.
Sorry, the question was, did Mohammed say that 99% of girls and women have had genital mutilation? So I think there was just a request to have that statistic clarified. I'm not sure where it was in the presentation, but perhaps, Qatar, you could, under the question and answer section, just type your answer so that everyone can see once you have a chance to.
Sure, I see the slide. So that statistic that actually Mohammed mentioned, it was 99% of girls aged 10 and 17 years had undergone a form of female genital mutilation or cutting in the DAP camps. That's the reference that Mohammed had shared in the presentation from the statistics he shared from the field.
Thanks for that clarification. I'll move on with another question. Oyefi has asked, what do you think is the role of social media in getting tangible results in this area? Would you think this is more effective in today's world? Definitely an interesting question in the context of, we're moving towards more remote-based approaches and more digital emphasis on digital connection as we are today. So yeah, any thoughts on the role of social media or other kind of digital ways of connecting and how effective they might be? I suppose in terms of order, since this isn't for any specific presenter, perhaps we could start with Qatar and then Rawia and then Hawa.
Sure, thank you, Stephanie. So definitely social media and internet are two key platforms, in particular during the times of the pandemic, to use them as platforms to increase campaigns and public awareness around issues tackling gender-based violence at home. However, there could be as well a challenge because there could be barriers of access to these platforms and of receiving information through them. And this is why it's important, I would say, to increase prevention campaigns on TV and other platforms, maybe radio and other platforms that sort of like enlarging the scope of accessibility in order to challenge sexist and misogynistic attitudes and beliefs, that could trigger gender-based violence or domestic violence for this matter. But I would say that even though social media and other platforms on the internet could be really a great source to spread knowledge globally, it is as well it may not be as effective because of access barriers that many folks in remote areas and around the globe may not necessarily have the privilege to have access to these platforms. This is why it's important to really, I would say, to be very context specific and explore the different platforms in the field that can be actually enhanced to explore the different many ways prevention and awareness can be raised regardless of just social media.
Thanks, Qatar. Rawia?
Actually, I can add some few points, but here in Jordan, during COVID-19, some cases reported the abuse during through the social media, actually. So I find like social media, it's good to first to raise the awareness of the GBV in terms of awareness again. And when we use social media or when social media work is connected with another intervention, it can be a very powerful tool to foster the change. So by this, but social media alone could not be effective. It must have another items to work along with it, but we can take the advantage of it by having the fact that it spread quite fast than other methods.
Yeah, so I have no disagreement, I think, with the things that have been shared. One of the things maybe I'll add is that social media has had a tremendous impact on our ability to share real-time information and so it's not just about a research study anymore. People have been able to infuse that research study with very tangible and very anecdotal experiences that are happening for them. And others, as a result of seeing people disclose or share experiences, have also started to share their own experiences and point people towards resources. So there's an enormous power, I think, in the way that we could utilize social media to be really effective in providing resources or access points or ways for people to connect. But we also have to, I think of the other layer, which I think Qatar referred to, which is not everybody has this virtual access. In fact, a lot of communities and people are still struggling, even within Canada. I was reading a story recently of somebody who was asked to work from home and had to drive 45 minutes to a Tim Hortons to sit outside in their vehicle to get enough signal to log in to do their workday. So this is here in Canada. So that tells you something about where there might be other places in the world where people are connecting around, are struggling to find ways to connect virtually and digitally with one another. And so we need to do a little bit more, significantly more, I think, as a world to make sure that everybody is still getting the same kind of access. Just because we're not the challenge around cost of flying can be translated to cost of engaging digitally, right? The barriers, the names of the barriers have shifted, but the number of barriers people have to kind of move through to get access to something is still very much present in our world as well.
Yeah, very interesting. Thank you. We have another question from Sumaya. What is the strategy taken to reduce GBV in a legalistic sense in the WUSC programs? So I'll kind of reinterpret that slightly because Hawa, you're kind of in more of a policy context. I think Rawia and Qatar, the question can be seen as kind of what types of legal policy systems change work might you be doing or supporting in some way in the context of the specific initiatives you're talking about now? And then Hawa, perhaps from your perspective, the question is more on, you know, what big legal or policy shifts do we need right now in order to improve this issue? And I think you've already touched on a few different pieces, but yeah, we can start there. Rawia, go ahead.
Yeah. And
then maybe we'll do Qatar and Hawa.
Actually, as I mentioned earlier, for our project, and we lead our project is Women Economic Empowerment Program, where we do not have like a really impact in the policies, government policies. However, we make the slightly intervention through doing that through our partners who they are already have this influencing. So what we are actually do, we trying to cooperate with them in order to change some policies and laws. But as a project is Women Economic Empowerment, but we include some interventions in certain areas because we know the GBV is a barrier that increase or decrease the opportunity for women to join the economic and the labor force. Therefore, I think this is what we do in the project. But however, we try to cooperate with the local agencies here that they heard here, and we try to promote also the community with the needed awareness sessions through also these partners.
Thanks, Rawia. Qatar, did you have anything you wanted to add?
Sure. I just would like to add that it's as well very important to engage male allies as actors in different sectors of influence, and to be like sort of as role models, really pushing laws and policies that will address and enhance response of gender-based violence. And in particular, since we're talking about the context of the pandemic, for instance, some of the ways maybe of systemic change would be to provide resources, more resources to women's organizations and support services, and really to treat these services as essential services during the pandemic. And we do understand that reporting rates may not be as high, because of the limited opportunities for women to report. However, we do know that the rates are really high. So it's important as well to lobby for exemptions of lockdown rules, for instance, for women victims of domestic violence, to still be able to find a safe space for them, regardless of the confinement and lockdown rules or any quarantine restrictions that actually may not allow them to be able to seek a safe space outside of their homes. So I would say there are different layers of support and really enhancing of frontline support to victims or folks at risk that policymakers can be able to push through and make it really smoother, and especially during the pandemic.
Thank you, Rawia and Qatar. I think there's a lot for me and Safia to think about in some of the things that you've both shared. I think there's lots of learning that can happen across a variety of different contexts. And I'd be curious to see or hear about if there are examples in policy changes or legal changes across the globe in other countries that people have seen done really, really well that we can maybe implement in Canada as a best practice. I think our responses to women in Canada are quite, our responses to any kind of equity-seeking group in Canada is not an appropriate response often. So, you know, as I shared, we have a wage department in the Government of Canada, so women and gender equality. And when calls around COVID disproportionately impacting women came forward, those concerns were moved to wage. And when we know that they're not concerns that just impact the department that focuses on women's issues, addressing any concerns that impact women, particularly violence against women, is a national problem. It's a national issue, it's a national concern. It should be at the center of our economy because women are at the center of our economy. We know this to be true, and yet we talk about these things as service delivery issues that need to be resolved. And so I appreciate the question around policy and legal frameworks. I also think it's the most difficult work to do because it requires institutions to change, and they're not remotely interested in the change if it disrupts the status quo. And so I'll maybe share again the things that I shared around the call to action. Canada really has to implement a national action plan that responds to the national inquiry into missing and murdered Indigenous women and girls. I think there's no other option at this stage but to address the escalating violence against Indigenous women and girls. And that's a plan that should be made into a policy framework that should be continued, right? We know that crises will happen. We know that there will be public health incidences. We've had several before across the world. What stops us from ensuring that those plans, we know they're there, incorporate a GPV lens, right? What stops us from pushing and asking for those things? And these are recommendations, again, that organizations have made for a very, very, very long time. And these are things that have to be written into policy. We can't continue to ignore them anymore.
Yeah, thanks very much, Hawa. That's a great point. You know, a crisis, although this particular crisis is, you know, unexpected, unprecedented, you know, we know that there will be crisis moments like this, and why haven't we already taken action on some of these core recommendations? So I'm conscious of time, that we're rapidly running out. It's been so great to hear from all our panelists. As closing remarks, I would ask each of our panelists, we can go Rawia, Qatar, Hawa, just for sake of having an order. If you could comment on two things. Number one, you know, as we've heard from recent positive news around vaccines, we shouldn't get too excited yet, but we know that a lot of great progress has been made, and we can at some point in, you know, the future, the medium-term future, anticipate less lockdown, more of a return to economic normalcy anyway. And my first part question is, what do you think will be the big shift in gender roles that we see that has been kind of caused by this extended period? And part two, a final kind of call to action. What is one thing that someone can do today about some of the issues that we've spoken of? So a tough question for your last round and your closing remarks.
Okay, I can start if you would like. Actually, regarding the first part of your question, maybe we have like negative and positive impacts for the gender roles. But if we want to look during the lockdown, some gender roles changed, where some husbands started to help to do the housework and to take care of children. So it was an opportunity to examine, for them to examine the gender role changes. However, a lot of women faced increasing in their responsibility to be like a double burden, and even they did not find the work-life balance. So I think this is a place where they started to examine, to exchange the roles a little bit. And it's a good opportunity for us, at least here in MENA region and Jordan, to start this change from here. And regarding the action per call, also it's a great opportunity. I know it's a crisis, however, it's a great opportunity for the government to see the gaps that they have them currently in regards the laws and policies of the gender-based violence and even domestic violence. It is an opportunity for government to find long-term solutions to make collaboration between the local and international actors with the government to change and develop the current policies and laws.
Just picking up from Rawia's point, and really there, as we all know, the pandemic has changed gender roles and conceptions of social gender norms in general. And I think collecting success stories of male role models really would be a great step to enhance and demonstrate the role of male allyship and healthy masculinity in programming. And I think that's really, those success stories goes a long way in demonstrating the positive role that men and boys can play in gender-based violence. It is as well important to, as a call to action, to respond from an intersectional lens and to be able to adapt any action to be really context specific and sensitive to the realities of the communities that are engaged. And I think that's a really key. I think really enhancing intersectionality is really a long way, and really continuing to adapt that to meet the needs of various communities in different contexts is really the way to go, to be able to have the folks that we are engaging on your side, and to be able to break through and make impactful results in programming and in community engagements in particular.
I don't even know where to start. I think, again, Rawia and Qatar have done an excellent job summing it up. Maybe one place I can differ is I don't know if we're going to go back to business as usual. I think this is going to have a huge detrimental impact on women and their gender roles significantly. I think we maybe were aware, but not in this very overtly public way, of the ways in which women are juggling a number of different ways that they contribute to our economy and to our society in general. And I think we're going to see a regression through no fault of women in any way, shape, or form, but because they've unfortunately had to make very difficult choices around advancement at work, around taking care of family members, taking care of people who are sick, taking on more time at work, and also the emotional toll of having to care, being part of the care economies during COVID. I think we're going to see a significant impact of that care work during this really kind of traumatic experience in time, and women will bear the cost of that moving forward. And again, I mean, the call to action that I would always say to people, or the thing that I would always say to kind of invigorate and encourage people to do more is there's nothing more critical than getting involved, whether that's at your local level, at your regional level, at your national or international level. Be fierce advocates for the things that you're committed to, and continue to push forward the ideas and thoughts and perspectives that are critical for you, particularly for women. And I think we can shift the world. We've got this really unique opportunity with COVID to fundamentally change some policies moving forward. We don't get those opportunities often. So this is the time to push and put your agenda of what you'd like to see happen also on the table.
Thanks so much to all of our panelists for really interesting insights, your valuable contributions, your incisive analysis of the situation. We're at time. I'd like to thank everyone who participated, who asked questions. If you do have further follow-up questions related to the webinar, I think that you can contact us here at WUSC through the information on the Eventbrite page. And we will also be sending out a very short post-event survey, 3 questions, just asking us how we can improve these types of events in the future. So we would really appreciate if you could take a few minutes to answer that when it's in your inbox as well. Hawa, Qatar, Rawia, Mohammed, thank you all so much. Enjoy the rest of your day, everyone.
Thank you. Thanks, everyone.
Thank you so much. Thank you.
Take care.